Hello, my name is Andrew Stas, and I'm a field care intern here at the Hagyard Equine Medical Institute. Well, there's two real reasons that I came down to the Lexington area and Hagyard specifically. Number one is just the massive amount of horses that are in the area and the caseload that a practice like Hagyard sees. There's nowhere else in the country or the world for that matter that you can go and see the quality of horses and the vast amount of horses here. Secondly, the reputation that a place like Hagyard Institute has just is really attractive to an intern looking to seek a greater education. It's one of the largest practices and one of the most premier practices in the country. Well, one of the big advantages that we see as field care interns is the ability to follow cases into a referral center where they have all the diagnostics and all the hospital things that we would like to do in the field but don't have the opportunity to see. So what we do is we have the ability to see a case on the farm, then follow it into the hospital if it does require a referral, see the workup and everything that happens at the hospital, and then follow it all the way through recovery until back on the farm when it's under our care again. And that ability to see the case the whole way through really expands your knowledge base and expands your education so that you know all the options that are out there for our patients. I would have to say my best experience can't be one in particular experience, but rather the ability to work with all the doctors that I get to work with on a daily basis. Some of the best practitioners in the world are here at Hagyard, and being able to work closely with them on premier breeding farms on very complicated and intricate cases is really a wonderful educational experience and something that I didn't really foresee to begin with, but has really opened my eyes to the quality of care that happens down here in Lexington. Well, I'd have to say probably the most interesting case was a yearling that we saw in the summer. The yearling decided to run through a fence, and doing so had broken probably about an 8-inch diameter fence post right off at the ground. In doing that, tore her pectoral muscle open. The wound was so deep that you could bury your hand basically up to your wrist into her muscle and into her chest, and right at the end of the wound you could feel the heart pulsing against your fingers, which was an interesting experience, kind of a scary thing, but that horse was literally millimeters away from life or death, and luckily for her she was okay, and we were able to close it up and went on to do fine, and will probably go on to be a successful racehorse. Well, I think the one thing that we're all kind of anticipating and looking forward to is the start of the breeding and the foaling season. In the springtime, the breeding season really starts to get ramped up, and that's when all the foals hit the ground. So the practice itself grows exponentially at that point, and we become a lot busier. So as interns that we really haven't experienced this season, we're kind of all really anticipating getting more involved and getting busier during the springtime and starting to see what the reproductive medicine is really all about down here in Lexington.